Today we're going to work on the traction, the cervical traction. In this position, let's try not to use the pillow. So the head can be flat, and also with the spine, it's going to be like the perfect alignment here. First of all, let's just feel the facet joint, which is on the side of the cervical spine. And then you want to go like 45 degrees down this way. When you bring your hands down this way, you can feel the facet joint. Kindly feel like if there's bump or tender spots right here, where you know that's most likely the patient complains about the pain. So first of all, we want to release the tightness of the suboccipital area. The suboccipital area usually is in a tight position. Keep in mind that when we work with the cervical spine, 9 out of the 10 cases, there is hypomobility of the C1, C2, which is the suboccipital area. From C3 to C7, there is a hypermobility, which is excessive extension. And from C7 to T7, that's hypomobility again, which is hyperkyphosis, usually in this position. And that's because when we sit perfectly initially, when we work with a computer or any kind of desk work, over time we kind of start to relax and slouch. Gravity pulled us down. We still need to look forward on the computer and see whatever and do whatever we're trying to do, right? So we kind of have to lift our head up, which causes the tightness of the suboccipital area and hyperextension of the mid-cervical region. So what we want to do is to release the suboccipital area and straighten out the mid-cervical area, and then we can turn the patient around face down and work on the upper thoracic area. Okay, so let's try not to have like long nails when we work on that. What we need to do is to turn the head to one side and position the fingertip on the suboccipital area, and turn to the other side and cradle the head, and then position the other hand like in this position. What we want to do is to kind of hold the hand in this position, so let the head naturally sit on the fingertip, but not on the nail. Try not on the nail, more on the pads of the fingertips, like this way. You don't have to do anything initially, just hold it vertically. What you're gonna feel is like butter on a hot knife, and the head is gonna start to drop, and the soft tissue in the suboccipital area is start to relax, and your fingertip will be able to feel the edge of the base of the skull. You can hold this position for about 30 seconds to 2 minutes. Of course, your hands gets a little bit tired. If that happens, you can roll the head to one side and kind of take turns left and the right. And I can feel, because when I tilt her head to one side, there's more weight on that side that she's tilting to, and I can feel the head is sinking down even more. And by that time, my hands get a little bit tired, so I can switch her back to the other side. Okay, so my other hand can rest. Now both are pretty much equal. I can just let it sit like this way. Now it's pretty relaxed. I feel like it's good distance that I can let my fingers sink into her suboccipital area. What I can do is do a little bit horizontal movement, simultaneously goes outside and simultaneously goes inwards. Kind of do a couple more times, about 5 to 6 times, and I can provide a little bit traction here. I'm gonna try not to use my finger to pull. I'm just gonna sit back and let my body weigh to provide a little bit traction. Again, let's try not to dig into her skin or the neck with my finger nails, okay? And hold it for about 20 to 30 seconds and relax. How does it feel?
feels good.
Good.
Feels tighter on the right side.
Right. So that's suboccipital release. And after that, I can roll her head to one side and cradle the base of the skull right here. All right. And there are certain ways, there are like 3 ways to do cervical traction in this position. So in this position, what we can do is just cradle the cervical area, and I can kind of hold the forehead so it's not sliding off, and I can just lean backwards. And again, about 20 to 30 seconds, relax for about 15 seconds. So it's 30 seconds to 15 seconds ratio. Provide a little bit of traction again. Or I can use both hands and just lean backwards. Both hands cradle the base of the skull, and try not to pinch this SCM muscle, the sternocleidomastoid muscle, when we do traction, because there are baroreceptors in this area on the bifurcation of the carotid artery, which can lower the blood pressure. So let's try not to apply too much pressure on this area. So we can do this for about 3 to 5 times, then turn the head to one side. Let's work on the supraspinatus and upper trapezius. Let's feel the spine of the scapula, and then what I'm going to do is to bring my elbow in so I can transmit my weight directly through my elbow to the heel of the hand, and I'm just gonna lean forward. And my left hand is kind of apply constant pressure to the GB20 area, which is the attachment of the levator scapulae and also the upper traps. And that provides a little bit inhibition techniques to the muscles, which is usually tend to be tight. So that's the supraspinatus and also the upper trapezius, mostly the upper trapezius. Now, a patient may have thoracic outlet syndrome where they have impingement in the scalene. And the scalene's muscle, we can also stretch in this position. The scalene goes from C23 to the first rib. The first rib is kind of sitting behind the clavicle. So you feel the clavicle right here, the first rib is right there. It's difficult to pressure and not comfortable if you just apply pressure to the first rib. So what we want to do is to use the first MCP joint right here and in this position and provide linear or vertical force towards the heel, towards the patient's heel. Okay. Also, you want to bring your elbow in so you can apply your body weight to the first rib. But on the other hand, you don't want to apply too much force. So you want to utilize patient's breathing to help you relax the muscle. When someone breathes in, inhale, the first rib kind of expand. And when the person exhale, it depresses, right? So it depresses. So what we want to do is to apply constant pressure right here. Okay, now Lisa, can you breathe in? You're gonna feel the first rib come to your finger, the first NCP joint, and then go ahead and breathe out. Only the first time you need to apply a little bit pressure. And after that, Lisa, can you go ahead and just take regular breathing? Now you're gonna feel the rib goes to your finger and goes away from your fingers. And when it goes away, you just follow with it. Try not to push too hard and just feel it. When it comes up, provide a little bit resistance. When it goes down, follow with the movement. Again, any kind of stretching, at least 90 seconds. This one you don't release. You just hold it there and then go further in as patient breathe out. Okay? All right.